Welcome to Registered Nurses Empire. There are 10 practice questions. You have 10 seconds to answer and check rationalization. Good luck. Question number 1. The patient is suffering from hydrophobia, fear of bodies of water. Which of the following models of care should the nurse implement? 1. Milieu therapy. 2. Psychoanalysis. 3. Cognitive behavioral therapy. 4. Group therapy. The answer is 1. Milieu therapy. Remember, milieu therapy is a type of psychotherapy that alters one's environment to prevent any psychological conflict or problem. Question number 2. A friend of a client with dysthymia and suicidal ideation asks the nurse if she will be all right if we invite her to hang out with us. Which response by the nurse is appropriate? 1. She is fine. No need to worry. 2. Maybe you should distance yourself on the first 1 week. 3. Just be yourself. Caring and loving. 4. Report to me if she manifests signs of suicide. The answer is 4. Report to me if she manifests signs of suicide. Dysthymia is a chronically depressed state that lasts for 2 years. The nurse needs to remind the people that know the patient to report any signs of suicide. Question number 3. Following an incident, a patient with bipolar disorder, manic phase was seen in the mall unconscious. After a few hours, the patient regained his consciousness and told the nurse that he took a handful of Prozac. Which of the following manifestation made the patient experience before the nurse arrived on the scene? 1. Hypertensive crisis. 2. Serotonin syndrome. 3. Grand mal seizure. 4. Waxy flexibility. The answer is 2. Serotonin syndrome. Remember, serotonin syndrome is a serious condition when both antidepressants are combined to administer. Manifestations are an increase in vital signs, muscle rigidity, pupil dilation, and seizure. Management is muscle relaxant administration. Question number 4. A patient who was a victim of a car crash a year ago was seen in the emergency room following another incident. During the interview, the nurse gathered information about his past medical history, and when asked about his car crash accident, the patient explained it with a happy mood. The defense mechanism that the patient used during the interview is 1. Dissociation. 2. Regression. 3. Conversion. 4. Repression. The answer is 1. Dissociation. Remember, dissociation is a mental process where a person disconnects from their thoughts, feelings, memories, or sense of identity. Question number 5. The client with bipolar disorder has been admitted to the psychiatric unit. During the rounds, the nurse talks to the client about his pending medication dose, and the patient replies, "I do not want to drink that medicine anymore." Which response by the nurse is appropriate? 1. Okay, I will call your healthcare provider to stop your medication. 2. Take this medication for the last time. 3. The medication will alleviate your symptoms. 4. We can mix it with your meal to enhance the effect. The answer is 3. The medication will alleviate your symptoms. Remember, this statement promotes reality and assertiveness. The nurse should not be manipulated by the patient. Question number 6. After a few rounds in the psychiatric department, a male client who is suffering from major depressive disorder asks the nurse, "I do not want to talk to anybody." Just leave me alone. Which of the following reply by the nurse is appropriate? 1. Okay then. Just let me know if you want to talk. 2. I want to be your friend. Give me a chance to prove myself. 3. What do you want me to do for you to like me? 4. I am your nurse, and I want to help you. The answer is 4. I am your nurse, and I want to help you. Remember, the patient poses threat to the public and possibly may harm others. On this occasion, a therapeutic way to ease the client's anger is to offer oneself, establish trust and rapport. Question number 7. The nurse is caring for a patient with a borderline personality disorder. For which of the patient's behavior should the nurse set limits? 1. Being manipulative. 2. Splitting tendencies. 3. Suicidal ideation. 4. Psychotic neurotic behavior. The answer is 4. Psychotic neurotic behavior. Remember, psychotic neurotic behavior can cause harm to others. Question number 8. A client with a history of major depression is having a problem when it comes to nutrition. Which foods would be the best for the client? 1. Meatloaf and rice with vegetables. 2. Egg sandwich with orange juice. 3. Chicken cordon bleu with rice and fruit juice. 4. Pieces chicken nuggets and French fries. The answer is 3. Chicken cordon bleu with rice and fruit juice. Since client with depression is not eating well because of how they behave, the nurse should offer foods that have a complete package of nutrients. Remember, physiologic needs are much more important than psychological needs. Question number 9. What is the most important aspect to consider when deciding which nursing care delivery system should be used? 1. Experience of staff. 2. Number of staff. 3. Staff licensure. 4. Staff preference. The answer is 3. Staff licensure. Remember, an essential component of all customer care delivery systems is determining who is responsible for making decisions regarding customer care. Question number 10. Which of the following questions should the nurse ask before verifying the symptoms of alcohol withdrawal? 1. What are the alcohol beverages that you usually drink? 2. How much alcohol do you usually consume in a week? 3. Is your family aware of your addiction? 4. When was your last alcohol session? The answer is 4. When was your last alcohol session? Remember that it is the way to determine when will the symptoms arise. Common anxiolytics such as chlordiazepoxide, Librium, is the drug of choice if withdrawal symptoms may manifest. How many score you got out of 10 questions, nurse? Job well done. See you